Are you constantly tired, dizzy, or getting strange tingling in your hands and feet, but can't figure out why? It could be something you're missing, like vitamin B12. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. And today, we're diving into a topic that might be the missing piece in your health puzzle: vitamin B12 deficiency. Vitamin B12 is essential for your body to function properly. It helps make DNA, supports brain health, and plays a key role in producing red blood cells. But here's the catch: your body can't make it on its own. You have to get it from your diet or supplements. And as we age, our ability to absorb B12 drops significantly. In fact, up to 20% of people over 60 in the US and UK are deficient. That's why identifying the signs early matters. Let's talk symptoms, and I'll be honest, some might surprise you. Have you ever felt strange pins and needles sensations in your hands or feet? Or noticed muscle weakness without any clear reason? That might be your nerve cells crying out for B12. One patient I spoke with, a marathon runner in his early 40s, experienced tingling so intense he worried he was developing a neurological disorder. It turned out to be B12 deficiency. Once we corrected his levels, the symptoms eased within weeks. Another red flag: extreme fatigue. And I'm not talking about being tired after a late night. I mean waking up exhausted after a full night's rest. That kind of deep fatigue is a hallmark of anemia caused by B12 deficiency. Without enough B12, your body struggles to make healthy red blood cells, which reduces oxygen delivery to your tissues, including your brain. That can also lead to trouble concentrating or even memory issues. Here's an eye-opener, literally. Blurred vision can be caused by B12 deficiency too. There have even been reports of people getting glasses, only to later find out the real issue was low B12 wreaking havoc on their optic nerves. Another sign that can show up on your skin? A pale or yellowish hue. This happens because B12 deficiency disrupts normal red blood cell production, which in turn can increase a byproduct called bilirubin in your bloodstream, giving the skin and the whites of the eyes that telltale yellow tint. Mental health is also deeply connected. Research has linked B12 deficiency with symptoms of depression, especially in children and pregnant women. It's a key nutrient during brain development, and some studies even suggest that being low in B12 as a baby can increase the risk of mood disorders later in life. While mood swings and sadness can have many causes, it's worth checking your levels if you're feeling persistently low. Even your heart may be trying to alert you. A fast or irregular heartbeat, what we call tachycardia, can sometimes stem from the heart working harder to push oxygen through the body when B12 levels are low. That stress can eventually lead to an enlarged heart or more serious complications if left unchecked. Now, the good news: most people can treat B12 deficiency easily. If you eat animal-based foods like beef, chicken, eggs, fish, or dairy, you're usually getting enough. But if you're older, have digestive issues like Crohn's disease, take certain medications like metformin or PPIs, or follow a vegan diet, you might need a supplement. B12 shots or high-dose oral supplements can quickly restore levels in many cases. At home, start with a B12 conscious diet. Think lean meats, milk, fortified cereals, or nutritional yeast if you're plant-based. If your symptoms are more severe or persistent, get your B12 levels tested. The fix could be simpler than you think. But if you're not quite sure what's going on and symptoms are piling up, there's a quick and smart way to check your health right now. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this video helpful, be sure to like and follow for more doctor-approved info you can trust from UB Health.